Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the common disease, that is bronchial asthma or asthma. The problem we face with this disease is by the time the patient comes to homeopathic doctor, he is already decided that this disease has no permanent cure. He has to suffer with the symptoms of the disease as well as the side effects caused by allopathic treatment. Most of the allopathic doctors say there is no permanent cure for this disease. They have to take medicines for lifelong. These include antibiotics, antihistamines, and steroids. These have a lot of side effects. Even with those side effects, patient has already decided that there is no permanent cure, and apart from the symptoms of the disease, he is also enduring the symptoms of the medicines as well. They have already decided that. They think that this disease has no permanent cure and no permanent solution. The next problem we see is, so because of this symptoms of asthma, though this affects different age group, children are mostly affected by this. So what exactly happens in kids is, because of this disease, they don't have proper diet, they don't have proper exercise, they don't have proper sleep, and their life is full of stress. Because of this, whatever they have to achieve in that age, they have to be healthy, they have to concentrate on their studies and career. So all this is lost because of two things. One is symptoms of the disease as well as the side effects of the medication they are taking from allopathic treatment. They take these medicines years together, not 1 or 2 years. They have been taking this for lifetime, full of side effects. And one more problem is, every time they go to a doctor, every year or every 3 months, they have to increase the dose. Increasing the dose means they have a lot of side effects and they get resistant to these doses. Once they get resistant to these doses, that will not work. For example, they are taking 1 mg today. After 3 months, they have to take 2 mg. After 6 months, they have to take 4 mg. In that way, every time they go to the doctor, the dose is doubled, so that it has lot of complications and side effects. Even though most of the kids as well as their parents know that this is not good for their children, using antibiotics, using antihistamines, using steroids or immunosuppressants is not good for their health, but still they are forced to use it because they think that they don't have any other choice. And also it will impact the milestones of the kids. Because of the side effects of the drugs, your milestones will be delayed. And we see in young boys and girls lot of secondary sexual characters which has to appear, or either early or which are delayed. So secondary sexual characters in the boys include beard, broadening of shoulders, mustache. All these things, change in the tone of voice, all these things are delayed, or there will be problems in this. In the same way, in the girls, the secondary sexual characters like development of breast, reduced hip to waist ratio in girls is also hampered because of this disease as well as the treatment taken for this disease. So it will have impact on their entire life. But most of the people doesn't know that homeopathy can handle this disease very well without single side effects. In most of the cases, permanent cure is possible as well. So such is the importance of homeopathy in case of chronic asthma. And coming to the statistics of this disease, almost 5 to 10% of the population will have this disease. Although it is common mostly in the kids below 10 years of age, it is also seen in adults as well. And also compared to the boys, it is very less in girls. For boys, it is almost double than compared to the girls. But when they grow in adults, it is almost 1 is to 1 ratio. But in childhood, it is 2 is to 1 ratio. Boys are affected twice that of the girls for asthma. There are huge number of symptoms that can be described for asthma. The one important symptom is wheeze. Wheeze is a small creaky sound that is coming from your lungs or chest when you breathe. So that is called wheeze. You can listen the wheeze in the background. This is a characteristic symptom of asthma. Apart from this, there can be episodic breathlessness, means there will not be continuous breathlessness. Normally, for some season or morning or night, they will have great breathlessness compared to other parts of the day or other parts of the year. There can be severe cough or light amount of cough, and also they feel tightness in the chest. They feel as if chest is constricted. You can also see the respiratory rate is increased, the breathing speed is also increased. And during expiration, when you expire the air, there will be rhonchi. Rhonchi are the special type of sounds that come in asthma when you exhale the air. There can be flaring of alanazai. Alanazai means the nose. Nose can be flaring, there can be wide opening of the nose, as well as normally we don't use accessory muscles of the respiration commonly. But in chronic asthma, what happens is they will tend to use the accessory muscles of the respiration like sternocleidomastoid muscles, muscles of the neck, muscles of the shoulders, as well as the muscles of the abdomen. These muscles are highly engaged to get the air inside. Symptoms are worst at night and also in the morning compared to other parts of the day. Special character of asthma is sometimes it can be atopic. Atopic means any allergy in your body. For example, you have allergic rhinitis, you have lot of sneezings or redness of eyes, burning of eyes. This can also lead to asthma. And also any food allergies can also lead to asthma. In the same way, any skin allergies, you have allergic skin. Any allergic reaction in your body can lead to asthma. This is known as atopic asthma. Coming to the investigations, there are very simple investigation. When you take a routine blood test or CBP, you can see the eosinophils are elevated, and also you can find the characteristic symptoms in chest X-ray as well. And also when you take the lung function test can also determine you are suffering with asthma. And also important test you have to do for this when you have skin allergy is you have to test the skin for allergens, and you have to avoid those allergens after the test. And coming to anatomy, there is one important thing you have to understand about the structure of the lung. So everyone will have a main pipe of the lung that we call as trachea. The main important structure you have to understand is the trachea and also its branches. The main windpipe we see here is known as trachea. The branches of trachea are known as primary bronchi. This primary bronchi again divided into secondary bronchi and tertiary bronchi. The tertiary bronchi are also known as segmental bronchi. So after tertiary bronchi, this will be divided into bronchioles. This is the important structure you have to remember for asthma. And coming to the physiology, it is important that your all the airways like trachea and bronchi are wide open so that air can come in easily and go out easily. If there is any obstruction, it causes problems such as asthma. And coming to the etiology means reasons. The important reason is genetics. Genetics means maybe your father or mother, your siblings, or your maternal side or paternal side will have asthmatic symptoms. That's the reason you have inherited it. Or else what happens is there is a new branch coming out, new science coming out, that is known as epigenetics. Even though your forefathers doesn't have asthma, you can develop asthma because of epigenetics. Epigenetics is the branch of genetics which now understands that there are some genes which are dormant in you. When certain conditions are there, these genes get activated and you will land into lot of symptoms. In the same way, asthma also have epigenetic background in it. What it means is even though your forefathers or your ancestors doesn't have this disease, you may develop it. That is epigenetics. Having said this, when you have the tendency in your body, and there are a lot of triggering factors which can trigger asthma. This one include infections. Any infections of the lung or airway can cause the asthma. And also some of the drugs, when you take some drugs, this can also cause asthma. And also some food, when you take certain kinds of food which are you are allergic, these also can cause asthma. And also sometimes exercise, even exercise precipitates or triggers asthma. Coming to allergies, allergens are the particles found everywhere and anywhere. When they come into contact with your body, they trigger an allergic reaction. This can be house dust. When you are allergic to house dust, this can trigger asthma. And also mites, which there are small insects in your house, these can also cause asthma. And pollen, so the pollen which is released from the plants can also cause asthma. And also when you have animals in your house, the odors released by them or the fur released by them can also cause asthma. When you have cockroaches, it can also trigger asthma. When you take some fruits which are allergic, or especially in Indian conditions, when you take tamarind, tamarind causes allergy in some people. And also citrus fruits, the fruits which are citrus or sour in nature, can also trigger asthma in certain people. It is not that but limited to these. Anything in the world can cause asthma or allergic reaction in your body. Some people are very sensitive to weather changes. Slightest changes in the weather can precipitate asthma. And also most of the people are susceptible to cold rather than heat. When it is cold, they develop asthmatic symptoms. And also sometimes stress can cause asthma. When you are under stress, depression, these also can cause asthma. Important thing to remember is your occupation. Occupation is also very important. When you are exposed to some of the chemicals in your occupation, such as chemicals, metals, or paints, or odors coming out from the paints, or cotton dust, or if you are working in any industry that produces fumes, can precipitate asthma. And also one of the important disease that can cause asthma is GERD, gastroesophageal reflux disease, where some people will be regurgitating the food or vomiting the food regularly. what happens is this can trigger the asthma as well. You have to be aware what is triggering asthma in you so that it will be easy to avoid that thing and get free of asthma. And coming to the pathology, what exactly happens in your lungs and in your bronchi when you have asthmatic attack? So when there is an allergen that enters into your respiratory tract, especially the large one, that is trachea and bronchi, there will be a hyper reaction to that. With this reaction, there are two things that are going to happen. One is your trachea and bronchi, which is wide open, will suddenly contract. That is known as bronchospasm. Because of that bronchospasm, what happens is that airway get narrowed, and also it irritates the mucous membrane. Once the mucous membrane is irritated, it produces lot of secretions. This is known as mucus that comes as a cough or sputum. So because of the accumulation of the sputum and also narrowing of the bronchi, these are the two things. One is bronchospasm and accumulation of mucus in the bronchi and trachea, that causes narrowing of airway. Because of narrowing of airway, you gasp for breath. The air you take inside is not sufficiently providing oxygen to you. That's the reason you tend to breathe more and you have the asthmatic attacks. And this bronchial wall, once it is exposed to the allergens, it is full of inflammatory mediators. It has lot of histamine in it and also a lot of other chemicals that can trigger further reactions. And also your immune cells, neutrophils, basophils, eosinophils, monocytes, all these are accumulated in your trachea and in your mucus and also in the mucous membrane of your respiratory system. Because all of this, you will have asthmatic attack or asthmatic symptoms. To understand it in a very simple way, you have to remember two things. There will be a bronchospasm where your smooth muscle, there is a muscle surrounding your trachea and bronchi. This gets spasm and this get constricted so that the airway is reduced. In this reduced airway, again there will be secretions. Because of the secretions, there will be further narrowing of the trachea and bronchi. This causes you to gasp for the air. This is the simplest way for you to understand about the reasons or the pathology of asthma. And coming to asthma, normally it is categorized into two categories. One is atopic asthma and one is non-atopic asthma. Atopic asthma is a genetic basis. You have already a predisposed genetic condition. In non-atopic asthma, there is no genetic predisposition. So atopic asthma is always because of allergies. So it can be skin allergy, it can be respiratory allergy, it can be food allergy, any of the allergies. But in non-atopic asthma, there is no allergic background. It can be directly happen. Coming to atopic asthma is mostly seen in children. The adults who are suffering from atopic asthma have a history of asthma from the childhood. But in non-atopic asthma, the asthma comes in the later age or the adult age. There is no history in the childhood. IgE is a type of antibody which is produced in blood. In atopic asthma, lot of IgE is seen in your blood. In non-atopic asthma, there is no raised levels of IgE. And coming to the conventional treatment is English medicine or allopathic treatment or a Western medicine or the treatment you go and take from a pulmonologist or a corporate hospital or a doctor nearby your home. All these constitute allopathic treatment. Basically, in allopathic treatment, there is no permanent cure for asthma, and also what they give are antibiotics, antihistamines, and steroids. All these have lot of side effects. For example, if you take steroids, what happens when you take steroids is it will decrease your immunity. Once the immunity is decreased, you will be prone to infections. Because of the infections, you have to again take antibiotics. Antibiotics also have lot of side effects. In the same way, they will use antihistamines. Antihistamines are the drugs that induces sleep when you take. Once you remove the antihistamines from your body, what happens is you will become insomniac, means you will not get sleep properly. There will be lot of sleep disturbances or immunity disturbances and lot of severe complications when you take allopathic treatment, both for children and adults. And as this is a chronic disease, you have to take it for very long time, and we have seen lot of side effects because of it. And even though all of you know that these medicines are not good for your kids, but are still you are forced to use this because you think that there is no other choice, but it's wrong. With homeopathy, there is best treatment for asthmatic patients. Even without single side effect, there is high chance that you can cure the disease completely. When you take homeopathic treatment for sufficient amount of time, the intensity of asthma is decreased, the frequency of the symptoms is decreased, and also duration of the symptoms is decreased. Over a period of time, your asthma will completely disappear in most of the people. There is no need for you to wait until the child grows to an adult and then asthma is stopped. Most of the allopathic doctors will tell that, so over a period of time when your kid becomes adult, the symptoms are gone. No need to wait till that long. See, when you take the treatment for the young kids itself, they can concentrate more on their studies. They can have very good diet. They can have very good sleep. They can have very good play and exercise so that they become strong and healthy and they become successful in life. That's the reason homeopathy is very important. Homeopathy is very timely. It is very quick in asthma. It doesn't have any side effects. It is also very safe, effective, and timely. Compared to any other treatment in this world, homeopathy has very good effect in asthmatic patient. It can control asthma very well, and also most of the times it can cure the asthma completely. And coming to the precautions, one of the important precautions you have to take is whatever the triggering factor you have for asthma, you have to come out of it and also take homeopathic treatment. Even though you have triggering factors, what happens is slowly the immunity against that is developed, and even though you have triggering factors, the symptoms will not develop in future. Coming to the other precautions, you have to take very healthy diet, take low carbohydrate diet. It is very useful. And also come away from vegetable oils and also refined oils. You stop using refined oils, take cold press oils. It is very good for asthmatic patients along with low carbohydrate diet. And sleep is also very important. Sleep up to 7 to 9 hours per day. It will improve the immunity as well. It will optimize the immunity. And coming to exercise, exercise regularly and be away from the stress. If you have any stress, try to come out of the stress. In the same time, you have to be away from your habits and addictions. If you are a smoker, if you are an alcohol, come out of it as early as possible. With these few lifestyle modifications along with the homeopathic treatment, you have high chance that you can cure the disease, you can reduce the intensity, frequency and duration of the symptoms, and you can palliate the asthma forever. And coming to the prognosis, what happens if you don't take care of asthma or you don't take homeopathic treatment? First complication that is going to happen is airway remodeling. What I mean by airway remodeling is normally the space in trachea and bronchi should become narrow only during asthmatic attacks. But over a period of time, what happens is even though you don't have asthmatic attacks, the bronchi and trachea get thickened and they will become narrow because the wall of the bronchi and trachea becomes thickened. That's the reason the airway passage will permanently become narrow. This is one of the complications. This is known as airway remodeling. Even though you don't have asthmatic attacks, because of thickened wall of trachea and bronchi, the airway is permanently narrowed. It is a very dangerous condition. The second complication that can occur is frictional stress. Because of frictional stress, what I mean by frictional stress is there will be friction between narrowed airway passage within the trachea and bronchi and also the friction between air. There is a lot of friction between these two. This can damage the mucosa. The mucosa is permanently damaged. It is highly inflammatory and cause of lot of infections because of this, and this can also become permanent loss of mucosa. That's the reason you have to treat the asthma at the earliest with homeopathic treatment. And finally, homeopathy is safe, homeopathy is effective, and homeopathy is timely in case of asthma. You have to consider asthma whether you are a kid or you are an adult. Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Fidicus Homeopathy offers you two kinds of treatment in asthma. You can take either in-person treatment or online treatment. In in-person treatment, you can directly come to us, inquire about the nearest branch of Fidicus Homeopathy and take the treatment there. And if you want to consider online treatment, it is very simple. Just make a call to us and we will give an appointment. That appointment can be just a voice call or video call. If any reports are required, you can get them done locally and send it to us so that we will analyze the reports and ship the medication to your doorsteps. Wherever you are in this world, you are in Andhra Pradesh, Telangana, India, Pakistan, France, UK, US, Germany, anywhere, we are treating the patients of asthma in the entire world. So homeopathy is specialized in treating asthma. At Fidicus Homeopathy, you have highest chance of success in any given disease compared to any other homeopathic individual doctor or a corporate hospital. We have the highest success rate because we don't compromise on the quality of the medicines and quality of the doctors. Our treatment is at the top for asthmatic patients. Apart from that, our treatment is completely transparent. What I mean by that is you will get the best information about the asthma and particularly in individual case, will give you the best information about your disease. Thank you.
Fidicus Homeopathy.